Welcome back to our five-part series on managing diabetic cataracts in dogs. We're joined by veterinary ophthalmologist Dr. Kellam Bayley, who's going to walk us through what do we actually do once we've diagnosed a dog with cataracts.
So, if you have a pet which has diabetic cataracts, and we're wanting to try and restore vision for them, the only treatment option for these is cataract surgery. And the basically the objective of cataract surgery is to remove that cataractus lens, which is cloudy and preventing transmission of light through to the retina in a way that it can focus, and giving them a nice clear visual axis. And so because you've got a big structural change in the lens which is making it cloudy, you need something like surgery to correct that physical change.
Right. And so what would make a dog a good candidate for surgery? How do you know if it's appropriate?
Yeah, so choosing, assessing animals for their candidacy is actually really important. So we need to make sure a few different things. One is that what is the state of the health of the dog? You know, is the dog in a good state and suitable to have an anaesthetic and a procedure done, or not? Or does it have other health problems which need to be corrected before going ahead with surgery? Another thing is to look at what is the state of the eye or eyes. Are the eyes in a suitable, healthy state to undergo surgery? Some eyes may have quite a lot of damage in them before considering surgery, which would make the eyes a poorer candidate for surgery. Um, and so they're really the main ones that we would look at for preoperative assessment, and that's something that is best done by somebody like myself, you know, a veterinary ophthalmologist, because they can look at quite a lot of different features and do a lot of different tests on these eyes to really most accurately assess the state of the eyes before deciding whether cataract surgery is appropriate or not.
That sounds like a great plan because you obviously want to make sure the animal can do well under the anesthesia and that if they're going to go for the surgery, that it has the best chance possible of restoring vision, which is really the goal for it. Read online now that a lot of companies or several companies are starting to sell drops and claiming that they're going to reverse or help slow the progression of cataracts. What are your thoughts around that?
Yeah, so there's quite a few different compounds which have claims against cataracts in dogs, which, you know, claims of clearing cataracts and things like that. And the short version is none of them are proven effective. There's compounds which have got no research around them. There's compounds, notably lanosterol, which has some research, but actually the research is not very good quality. There's another compound called kinestat, which actually has got some quite good effect. Unfortunately, it is not available and not manufactured for use. So, you know, really, when it comes to eye drops, there's no proven effective eye drop to resolve cataracts, and that's in all species, right? So in humans, cataracts are really common. In fact, cataract surgery in people is the most common elective procedure done. Basically, if you live long enough, you'll get cataracts. And so if there was an ability that they could manage some of these without surgery, they would take it. And they don't. You know, they don't. The cataract surgery in people is a huge thing.
Mm.
So, and unfortunately, that's the same with dogs. There's no effective option other than surgery to restore vision.
So because cataracts are permanent, we're really looking at surgery, and the best bet is to go to your vet and have them refer to a veterinary ophthalmologist who can help decide if that patient's a good candidate.